Recently, the Indian government legalized surgeries to be done by doctors trained in the ancient Ayurvedic school. But the Indian Medical Association, an apex body of doctors in India, declared a nationwide strike on December 11th to demonstrate discontent with the move. India has 7,70,000 Ayush doctors. It includes prevalent systems of Indian medicine, Ayurveda, yoga, naturopathy, Unani, Siddha, and homeopathy. More than half of them are practitioners of Ayurveda. They lack necessary allopathic training and have often been accused of irrationally using antibodies to treat patients. Ministry of Ayush clarified, saying that the notification is specific to 58 surgical procedures and does not allow Ayurvedic postgraduate students to take up any other surgeries. Allopathic doctors across the nation are concerned about the implementation of mixopathy. They say that mixing various streams of medical science could be a threat to human life. Doctors are staging demonstration to express their disagreement nationwide. The Indian government believes that there are a lot of people in India who don't have access to medical care, and these doctors who learn the human body, just like any other doctors, will be able to handle these surgeries. While these doctors may protest, the government of India is in no mood to relent. They have disregarded decisions by the allopathic bodies and will implement what they have decided. Bureau Report, Democracy News Live, New Delhi.
It matters. That's the show we run on Democracy News Live to focus on issues that really matter. We stay away from the noise and we focus on what's really important for you as the audience. Today's show is around the Indian government's decision to allow Ayurvedic doctors to carry out 58 surgical procedures. Now, there is a whole lobby of allopathic doctors who says the Ayurvedic doctors are not trained to do these surgeries. While on the other end, the Ayurvedic doctor says they're trained to do these surgeries. Now, this whole mix of Ayurveda, allopathy, and there are other medicine forms in India which are historical, is a little cusp. Many procedures use different other things in Ayurveda to build on themselves. But this whole idea of Ayurveda and allopathy, let's kind of clear the air a bit. But I started the show by speaking with Dr. Abhay Phillips from Kochi in Kerala. And I started by asking him, why is this decision by the Indian government not the best decision from his perspective?
The current law that was decided upon regarding Ayurvedic practitioners performing surgeries, even though it sounds like a good move because you will have more manpower in dealing with patients in the country. But on the other side, this decision is actually a double-edged sword. I'm saying double-edged sword is because in Ayurvedic syllabus, modern medical training, its practice, its teaching is not followed. What is followed is what was written eons ago and based on ancient texts. Even though they claim that a lot of their textbooks are based on new teachings on human anatomy and physiology, there is a great deficit when it comes to actually the practicality of the whole situation. Even though proponents of Ayush consider Sushruta, or everybody considers Sushruta as the father of surgery, John Hunter is the father of modern surgery. He has actually made surgical science into a properly channelized, practical, evidence-based, empirical science. And this part of the science is not there in Ayurvedic training at the moment. And another more important part is that surgical sciences, apart from the knowledge and the theory, it actually depends on a lot on how the surgeon is skilled. And for that, the students of surgery, they undergo rigorous training over years, and they undergo training for 5 months in bachelor's, then in the master's, and then in super specialty. So that's actually about 9 to 11 years of training, which actually the current Ayurvedic syllabus lacks. Even though they have postgraduate courses, we are not sure that how much that actually helps when it comes to the skill part of it. Minor surgeries, suturings, maybe yes, it's good for rural practice. But the whole issue is that when there is a need for a proper surgery, for example, obstetrics and gynecology related surgery, people in the urban and suburban regions, they can always approach a properly trained scientific evidence based surgical practitioner. But people in the rural areas, they will be stuck with an Ayurvedic practitioner who has been recently promoted by the government to perform surgery. This is not right. There is inequality here. Everybody in the country has the right to proper health care, proper surgical care. I said this very easily, but it's not so easy because there is great discrepancy in performing a global healthcare or a proper righteous healthcare for everybody in the country, and this is what is lacking. And the government is trying to bridge this, but this is not the right way to bridge it. I do feel we need better solutions for this, especially for the rural Indian population who cannot travel or who cannot afford current modern medicine based treatments, or who cannot approach these science based evidence treatments. But this is not the way. That we don't allow pseudoscience to percolate into our scientific practice. We have to train properly. We have to increase the inputs and thereby the output in properly trained medical personnel. And this is the only way that we can fight our lack in medical and surgical practice. Ayurvedic practitioners are not trained in the right evidence-based scientific skill set that modern practitioners are trained in. And there is a great divide in how they think for the patient and how evidence-based practitioner thinks for their patient. And a lot of it is derived from ancient text. There is very less that is derived from proper evidence-based scientific practice, because the teaching is completely lacking in Ayush-based medicine. It is an alternative stream of science, and it can never become a mainstream until and unless it is run through a proper, rigorous scientific approach. And this is currently lacking. Just empowering an Ayurvedic practitioner to perform a surgery does not make him a proper surgeon. It only adds to quackery. It adds to fraud that this nation is currently fighting against. And it is important that the government does not decide these just based on numbers, but it has to come from proper advisory panels and committees, and it has to be a collective decision on how to fight such discrepancies in healthcare. Thank you.
Now, joining me on the show live is Dr. Abhay Kumar Singh. He's a surgeon. He's at Safdarjung Hospital. It's one of India's premier hospitals, and he's part of the Delhi Medical Council. Also joining me is Dr. Amit Verma. He's a founder of Vrikshakalpa Ayurveda. Now, in his clinic, there are many doctors, Ayurvedic doctors, who've already performed surgeries. So let me start by asking Dr. Amit Verma. Dr. Verma, do you think this decision by the government of India is in line with what you already practice? Or do you think these 58 procedures that the government has proposed that Ayurvedic doctors will perform will actually put people's life at risk?
Yes, sure, Rohitji. Just I want to let you know one thing: the 58 procedures which were allowed by the government of India. These procedures are specified to the surgery which we having the department, like we have the PG department of Shalaka and Shalya. So where we do perform surgeries already related to the eyes, ear, and some basic surgeries, general surgeries, and the surgeries which are very specific and specified to non-vital organs. And that was the what government is saying now, okay, like 58 procedures, in which the procedures which are included, which is not for the vital organs, which are for the non-vital organs, and the some simple surgeries for the eye, ENT, and which were very well explained in our literature, and which is practiced already by the doctors and which is already taught in the institutions very well, and very well training is given for all these procedures. So what is actually happening, like before that the amendment was there, like either doctor should allow for the surgery, but that was going on when it will be declared by the government of India. But there was some specific procedures which was practiced all over India, as I told, as it's very known procedure Shar Shutra, which we do for the piles and the fissure and fistula. So what we are doing from the long time, and it is giving very efficient result. The thing is when we know that this procedure we can practice easily and we can practice legally, so that was the training for those procedures was given very efficiently in the institutions already. Although we are reading the surgeries literature for the every kind of surgery which is allowed now by the government. So when it is allowed now, it will be trained more practically in the institutions, because the graduate or the postgraduate who is doing the post graduation in particular subject, now they know when they do the post graduation they can practice it legally. So they are going to train more efficiently in that core area. So
So,
that is what we.
Dr. Amit, what you're saying is that you were trained in it. It was not legally
Yes,
allowed to do these procedures till now, but the doctors were already trained in it. And now that
yes,
the government has made it legal, the teaching methods may also become more intricate, and doctors can practice it a bit better in their post
yes,
graduation degree to be able to carry out our. Dr.
yes,
Abhay, you certainly are not pro this idea of the government allowing these procedures, which are described as allopathic procedures, to be done, because this is not how Ayurveda came around. This is not the basis of Ayurveda. These surgeries did not start in Ayurveda. Explain to me what is the Delhi Medical Council's perspective on this decision by the government of India.
Regarding DMC or any allopathy medical body directory or their common thought process, which we all share as a trained surgeon, that I have nothing to against be of talking of any other pathy and all. What I would rather want to emphasize is what's the ultimate patient healthcare will be because of this decision. What exactly the training process, and to be very frank, the above all is that the government, the decision of basically starting this process of training Ayurveda doctors so that they can execute surgeries like ENTI, some general surgical procedures and others. uh, uh, it can be very easily summed up, like why the notions is against it among the allopathic practitioners or the trained surgeons is, sir, it's a thing to understand that the medical graduate seats in India right now is around 70,000. We basically produce around 76,000 medical grad in India right now. This number, if we will, and I'm talking only about facts, there is no exaggeration of any emotions and something like that. And in 2017 the seats were almost around 56 or 57,000. Now backdated in 2017 we have PG seats of almost 26 to 27,000 in India, and as of now, as per the figures and all, it is around 40,000, 43,000 is the number of postgraduate seats. I have a very simple to ask from whosoever is defining this logic, and the government of India also, that if still it is 40 or 43,000, then the rest of the people who basically apply to become a trained surgeon, like NEET postgraduate entrance, which is the biggest platform of becoming MD MS doctor in India, still have, sir, 1,20,000 trained MBBS doctors who are willing to learn these surgeries, who are willing to learn all the procedures hailing from small scale to the bigger aspect of any surgical specialty. If I am an ENT, I know how tough it is for any surgeon, be it me, be it any Ayurveda, be it Unani, Siddha, any doctor, to train into these sort of things. Secondly, sir, when 1,20,000 trained MBBS doctors are already in a process of joining such seats so that they can learn it, and if given an opportunity to work in a proper government setup or a peripheral setup, they have no hesitations. It's for our knowledge that everywhere in India, almost, be it a private medical college or a government medical college, the government is imposing a bond to serve in the village and peripheral areas. Government is also giving us an opportunity to go through these PG seats by doing a government job and all. But the whole context of it is that if we are going to allow it for the people from Ayurvedic courses, are we making sure that enough measures are to be drawn so that all the MBBS grad who can still learn the surgery, who can go to the peripheral setup also, who can go and perform the surgeries over there, are we giving them a proper platform? I think
One thing, Dr. Abhay, what you're talking about is the number of seats and, how many seats and how many more people are willing to learn. But what I think everybody, and including the government of India, is talking about is that there aren't enough doctors. That's the reality. We travel through rural India, anywhere, there just aren't enough doctors. And what the government is saying is, here are tens of thousands of Ayurvedic doctors who've been taught these procedures already. If they can technically do these procedures, then they should be allowed to do these procedures. It doesn't matter if there are more doctors who want to learn and who can learn. But if these doctors are trained and they actually can carry out these procedures, then what's the problem? So explain to me from your perspective, if, for example, Dr. Amit, who's on our show, he's not a surgeon, but if he was a surgeon and he was capable of doing the surgery, and he would do the surgery, then what would be the problem with that? The seats and the numbers and all are just numbers. At the end of the day, the patient wants to see him heal and heal fast in time. So explain to me, where is that challenge? Are these doctors trained or these doctors are not trained? What are you telling me?
I guess you had asked me a very good question in which the majority of the answer part is also in the question. See, you are very right. If it is all about like seeing patients, doing it like a physician and all, the training would be a lot easier. But when it comes to surgery, precisely, and I'll be very precise in some micro surgical procedures, because majority of the major procedures are still, would be saying that many of the Ayurvedic practitioner also operates. I am not sure whether how much they are allowed to do it, and it's none of my business also, to be very frank. As per their rules and as per their curriculars, whatsoever they are allowed to do by their bodies and the government of India, they should do that. But the thing is, suppose we have taken this decision that we have to basically train these people into doing some more procedures. I have only one thing. Uh, have they formulated any training frame? Have they captured few really good surgeons who can train them? And to be very frank, how is the curriculum designed? Like, the see, any post graduation or learning into post graduation is totally based upon the reformation of the undergraduate teaching. Like, if I'm an ENT surgeon, in my MBBS days, I had an year where I read ENT subject. I went to the OT where a senior ENT surgeon was operating. I saw a lot of residents who were seeing that. I see a lot of postgraduates who are also seeing that surgeries. So there is basically a training formulation, there is a training protocol and all. So all that thing is very, very mandatory, first of all, to start such things. Secondly, why we are making it a gray zone? Why we are making it a gray zone? See, it's totally absolutely given to the authorities and the government of India that whatsoever can be taught well should be taught well to all the doctors who are pursuing the forms of Ayurveda and all, and they should be allowed to do that. But the things were going very smooth and fine as of now. And what I have seen in peripheral setups, because I have been in a almost 7 year in a very big tertiary care center, and in my practice I do operate a lot of cases. What I've seen is this doing surgery especially is a very fine business, and when it comes to the surgical things like eyes and ENT, it needs a years and years of training. We, to be very frank, if you'll ask me that whether a postgraduate will be trained enough, no, I will never say. In 3 years of our residency also, we need to train ourselves post residency also. So the first thing is that the more and more such facilities are right now available with allopathy form of medicines, the proper surgical training institutes and all. So it's not about letting people giving a vision that they can do, but the thing is, what is the infrastructure? Who will gonna train them?
Dr. Amit, let me ask this to Dr. Amit. Dr. Amit, now what Dr. Abhay is saying is that the Ayurvedic universities and schools do not have either the basic knowledge in place or detailed information and practice on doing things like ENT. And honestly, if I were to show my eye tomorrow in the morning, if I have a problem, I'd be worried when I went to an Ayurvedic doctor for surgery specifically. If it was medication, I'd possibly come. Explain to somebody who wants to come get a surgery done for his eye or her ear that why do you think Ayurveda is capable of doing it? Because the government certainly thinks they are.
Yes, sure, Rohit. I do agree with the concern of Dr. Abhay. Okay, I am 100% agree with the what concern he is having, because he was having two concerns. One is for the regarding the health of the individual who is seeking the health from the professionals, like whether it is safe to go in the hands of for the surgery with the Ayurveda graduate or Ayurveda postgraduate. Second concern was regarding the seats, what will be the future of the allopathy doctors, what they are going to do that. So that concern you already had answered. Okay, like that is not a concern. If anyone has a skill, or if he is the graduate, or if he is a holder of a degree, he can do that. And coming on second part, where what is the life or what is the future of the person who is seeking the seeking for the surgery with a health professional. So first of all, one thing, like how the students are studying in the allopathic medical college, like MBBS. When they are studying MBBS, they are studying the different subjects like pharmacology, surgery, eye, ENT, or the clinical bed practices, whatever subjects they are studying. If you see the syllabus of the BMS graduate, these all subjects are included in the course. So already it was like when I did graduation, these all subjects had been taught to us in detail, like pharmacology, surgery, IENT, everything, like how they taught to MBBS graduates. And when it comes out of surgery, like we also do see also have seen the procedures when we are in the graduations, like different procedures, whatever they were performing in our college, we have seen that. But the term comes when we go for the masters. Like I did my masters from SDM College of Ayurveda Hospital, Hassan. Okay, I have seen that there they are following all the protocols, all the standard, and well was compact knowledge of surgeries whatever they are practicing there. And I have seen the tremendous amazing colleges or hospitals of Ayurveda where they're practicing IENT surgery in South India, okay, in Kerala. So they were practicing eye surgery, ENT surgery in a good manner with all formalities, all the conditions, and all the rule and regulations they were following in their institution in the hospitals. My simple answer is that if such kind of facility, right, definitely if they are allowing the surgery in the Ayurveda colleges and institutions and hospitals, definitely the rule is not going to change for anyone, whether it is a graduate from the Ayurveda, whether it is graduate from the MBBS. Rule is same for everyone for surgery. Like they had to follow the some sort of rules or regulation which is mandatory for every kind of surgery. Even for the training, if the rules are mandatory and regulations are mandatory, these are the basic things every institution, every college should have before they are teaching surgery to any
So I
graduate.
have a question,
Definitely
Doctor.
it's same.
Dr. Amit, I have a question. I have a small question here. So let's say I go
Yes.
for a eye surgery. Now,
Yes.
if I'm put in, obviously, I'll be given anesthesia. Is
Yes.
anesthesia part of Ayurveda?
So presently, anesthesia is not a part of Ayurveda. But like the concept is here that when we are going forward, if we have to take help, like in ancient Ayurveda, when Ayurveda literature, if you see Ayurveda, there were the methods for the anesthesia. But maybe that is not practically possible nowadays. So we are using the latest technology with the help of other individual. If you are going to conduct a surgery, definitely, like for example, if we have to do some surgery, okay, if we need help of any other professional doctor, maybe of the MBBS or MS, then there is no harm in taking help in collaborating. The mission of government, what I understood from government of India, they are trying to create a huge platform of surgery for where the both pathies can combine together and create a huge platform where the surgery procedures can be conducted.
Now, next stage, let's say a surgery is done and you're
Hmm.
now out of surgery. You may need an antibiotic to stop infection from the surgery.
Hmm.
Now, will the Ayurvedic doctor prescribe an allopathic medicine or will they prescribe an Ayurvedic medicine?
Uh, Rohit sir, I am practicing since last 6 years, or I have seen the different infections patient. Even though I have seen diabetic foot, gangrene, so many patients I have seen in my life. Even though dengue, typhoid, I am practicing since last 6 years without any antibiotic. Means I do treat infections with the Ayurveda medicines only. I don't feel like that. Like I need to write allopathy medicine. Yes, if some patient is not under control, some situation is not under control, rather than writing allopathic medicine from my side, I do prefer take referral from other allopathic doctor. Okay, this patient I'm referring to you, what best can be done, you do from your side. I am doing this all treatment. There's no harm in doing that.
And I understand. Understand. I have just questions, because I think the audience wants to understand as well. Now, the surgery in itself, for example, let's say an eye surgery, was this part of the original Ayurvedic medicine as a discipline? Do you think in
Yeah.
the 13th century, 14th century, were they carrying out these eye surgeries?
Yes, Mr. Rohit, there is a lot of huge information regarding the eye surgeries was performed in Ayurveda, and there is huge literature available that, and there is a complete procedure. Like you can't believe if you read Shushu Samhita, there are 120 instruments was mentioned which were used in different kind of surgery. Even it is mentioned in detail which kind of instrument should be used in which type of surgery. If you are doing the surgery for the eye for the cataract, which kind of instrument should be used. If you're doing for fistula, which instrument should be used. If you are using for excision, if you're using for incision, every detail of instrument is mentioned in the Shushu Samhita. And if you see today's scenario, same instruments are used. Still, this the same
Doc-
instruments are using.
Dr. Abe, do you want to respond to that? Because, honestly, from my perspective, I'm sitting here in the center. I'm looking at both these ideas. For me, one or the other doesn't matter. At the end of the day, the patient must have,
Yes,
medicine where the person is saved. It doesn't matter who gets employed, who doesn't get employed. That's not what my role is. My role is to make sure that the information gets to the people. From your perspective, does Ayurvedic, does an Ayurvedic doctor today have enough knowledge to be able to carry out these detailed procedures on the eye? And I'm just taking eye as an example because it's a very sensitive part beyond many other things as well. Can you just weigh in on that?
yes. During the
If you
masters
talk
of the
No, 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 I'm asking Dr. Abe. Sorry.
if you talk
okay,
about the current situation, my personal views, and not only my personal views, as per the training infrastructure we have at respective places, I would say no, absolutely no. As of now, I am not restricting it that it cannot happen in future with a proper planning and proper infrastructure and the proper welcomeness of the trained surgeons, so that who can train surgeon to be in the future. But the point here is it's not about being an allopathy and Ayurvedic thing. Like, I am very happy to hear from your questionnaire to Dr. Amit that surgery is not a game which has to be performed on table. To be very fair, the game initially starts from a pre-operative workup to the diagnosis. Then we plan it, we do all sort of pre-operative necessary investigation, and then we take help of all the things which has been taught to us from the initial days of our undergraduation. And as a surgeon, like you talked about antibiotic, there are analgesics also, and there are other things which we have to take care of. Dr. Amit, as per his views only, what I heard it in the recent talk of his is that he tend to deal everything with his Ayurvedic knowledge and all, and which is very respected. And absolutely, I give it to him that he is following his own practice. But if we have to go by a general consensus, it's a very common practice among the Ayurvedic and other practitioners also to inculcate the allopathy practice to give better results. Though I am a little more disagreement to this thing, because to inculcate anything in a shorter basis will never leave you with a proper understanding of it, and sometimes unintentionally you may do a little bit of haywire to the things which you are planning to attempt. So as of now, considering the scenario, and the training centers, especially the micro surgeries. If I'll talk about eye, if I'll talk about ear, nose, throat, and all, having respected views for all the procedure which is done as an Ayurveda surgical
Sure,
aspect.
sure,
But
sure,
if you ask
Doctor.
me about Setway,
So I get your point, Dr. Abhay. So what I think Dr. Abhay is stressing on is standard operating procedures have always been part of the medical practice. SOPs are something that must be followed, whether it's Ayurveda, whether it's allopathy, or whatever be the form of medication or medicine. Now, the idea is that if at all these two schools need to be merged, the Ayurveda, the Unani, and allopathy, and the other three schools as well, whether it's homeopathy, acupuncture, whatever it may be, then there has to be a proper process around it. It must also have the blessing of these associations. They must, sit down together. It may take a few years longer, but it cannot be that people land up for surgeries and their life is at risk. I'm sure there may be a lot of doctors who will be able to carry out these surgeries. For example, we've found a lot of doctors carrying out renal transplants without any proper training, without even being doctors at all. So it's not as if it cannot physically be done. But what happens when things go wrong? Is there enough training for that? And I think that's the idea. So what I think we should concentrate on, the medical associations, whether it's Ayurveda, allopathy, they should all need to sit together and kind of figure out a strategy forward. The government is obviously, pronouncing this without the blessings of the medical associations. It's at least part of it, especially the ones which are in charge of allopathy today and carrying this out. I certainly don't understand what the thought behind this or what the education and knowledge behind making these decisions are. And if it is, that's the case, then there needs to be an open debate. You need to call the best doctors in the country on a public platform, have a proper discussion around this. You do not carry out laws, subvertly. Make sure you bring the head of All India Institute of Medical Sciences to a public platform. Let there be a discussion with the head of the Ayurveda and see if this process is a way forward or there are challenges with it. So certainly time to do a rethink on what decision this is and how this is going to impact. I want to thank Dr. Abhi Philip, Dr. Abhay, and Dr. Amit for joining me for this show. I think it's an important one. The people want to hear about it. The people want to understand it, what's going to impact them. Thank you for joining me. Good night and good luck.